Joining us today is Derek Hammacher, Chief Administrative Officer of Community Health and Dental Care. Derek, thank you so much for joining us.
Thanks for having me.
All right, so can you talk about what integrated behavioral health is and how it differs from traditional behavioral health?
Surely. So when most folks think about traditional behavioral health services, they're usually thinking of what's known as outpatient psych or counseling or psychotherapy, where someone sits with a licensed clinician for 60 minutes and engages in deep conversation and maybe meets with them for long term. Integrated behavioral health, when we're referring to that, we're referring to that licensed behavioral health clinician actually being embedded in a primary care medical practice. So that licensed behavioral health provider is working right alongside a medical provider and consulting and providing some brief treatment to the medical patient and consulting with the medical provider.
And that's even better for the patient to have everybody working together.
Absolutely, holistic care, yes.
What services does Community Health and Dental Care provide for treating patients with behavioral health issues?
Sure, so any of our patients that are experiencing behavioral health symptoms, they can get consult with what we refer to as behavioral health consultants. Those are typically 30-minute encounters with the patient that happen right in the exam room, typically after a provider meets with the patient. We offer screenings to new patients, to patients throughout the year if they're suffering from depression or ADHD, PTSD. And then the BHC also helps the patient get connected to external referrals, such as psychiatry or long-term counseling.
Wonderful. In what ways does mental health influence physical health? The physical health impacts our mental well-being. It's all tied together, isn't it?
It is all tied together, and actually we've done a really good job over the last decade or two gaining an understanding of the bidirectional relationship between mental health and physical health. Just to give you a quick example of how mental health can affect physical health. Someone experiencing depression, especially if it's chronic and persistent, they may have a diminished lack of motivation to get out and to exercise, something that you and I may take for granted. Over time, of course, that leads to a bit more of a sedentary life, which could put somebody at higher risk for cardiovascular disease and obesity.
Yeah, it does have a link. And what kind of screenings do you have available?
So we like to screen all new patients just to get a baseline of how they're presenting to us. Those are typically depression screenings, substance abuse screenings, and then also screenings that try to gather social determinants of health of patients, things like housing insecurities or food insecurities. Aside from new patients, with patients that are engaged in our practice, if someone has a depression diagnosis, we typically like to screen them for a longer form of a depression measure, twice a year.
Okay. Derek, thank you so much for joining us on Community Connection.
Thanks, Liz.